Everyone. So today we are going to see an important topic, the different storage temperature of the various blood components and the volume. Okay. So you can collect the whole blood and separate into different components by different methods. So you can get a whole blood like that from any donor, or you can get packed red cells. You can separate packed red blood cells from the whole blood. So what's the ideal temperature you store at which you store these packed red cells and whole blood? Okay, so all these are important. So what is the volume of whole red blood cell or the packed red blood cells? So the volume is usually 350 ml, and the temperature at which you store it depends upon the type of anticoagulant used. So they are usually stored at 2 to 6 degrees Celsius. They are stored at 2 to 6 degrees Celsius. So you have various anticoagulants used for storing whole blood or packed red cells. You have different anticoagulants. One is ACD bar CPD, that is acid citrate dextrose or citrate phosphate dextrose. Then you have something called CPDA. Same thing together with adenine. Okay, with adenine. Then you have something called SAGM, saline sodium adenine glucose mannitol. So you have three different anticoagulants: ACD or CPD, CPDA and SAGM. Sodium, adenine, glucose and mannitol. So depending upon what anticoagulant you have in the blood bag, you store it for different temperature. When you use a ACD or a CPD, you can store it for 21 days. When you're going to use a CPDA, you can store it for 35 days. When you're going to use a SAGM, you can store it for 42 days. So this is about the volume and the storage temperature of your whole blood and packed red cell. So the next component which we are going to see is fresh frozen plasma. Fresh frozen plasma or FFP. So you can derive FFP from your whole blood. So what is the usual volume of fresh frozen plasma? So fresh frozen plasma, the volume is usually 200 ml, and you can derive cryoprecipitate from fresh frozen plasma, and the volume of cryoprecipitate is usually 10 to 20 ml. So both FFP and cryo are stored at minus 30 degrees Celsius for 1 year. They can be stored at minus 30 degrees Celsius for 1 year. Okay, so cryo, the volume is less, FFP the volume is more. Okay, so this is about your FFP and cryoprecipitate. Then any guess what blood product I'm going to talk about on seeing this instrument? So what is this instrument? This is called platelet agitator. This is called platelet agitator. So what is the volume of platelet and what temperature do you store platelets? So platelets are the only blood component which are stored at room temperature. So they are stored at 20 to 24 degrees Celsius. They have a very less shelf life. You can store platelets only for 5 days, and you have to place the platelets in this platelet agitator. It will keep on shaking. It should be kept in some motion. So I've discussed so many blood components like your packed red cells, then your FFP, your cryoprecipitate and your platelet rich concentrate. Of all the components, which do you think is more prone to get contaminated by bacteria? The one which is stored at room temperature is more prone to be contaminated by bacteria. So remember, because platelets are stored at room temperature, they are more prone for bacterial contamination, and they can be stored only for 5 days. So this is just a summary. So of the different blood components, your whole blood or packed red cells can be stored for different days depending upon the anticoagulant used. So it's usually 2 to 6 degrees Celsius. If you use a ACD or a CPD, it's 21 days. If it's CPDA, it's 35 days. If it's SAGM, it's 42 days. And for FFP and cryo, it's 1 year at minus 30 degrees Celsius. And for platelet rich concentrate, it's 20 to 24 degrees Celsius for 5 days. So thank you.